you talk about who is eligible for the booster and what might be next after getting a booster shot?
Sure, I'll be happy to do that. So booster doses are really, really confusing, by the way. And so if you're confused by them, you're not alone. There are a whole lot of us that are confused about booster doses. The first thing I can tell you is that the vaccines that we have now, even after 6 months, still protect really well against serious illness and hospitalization and death. Okay, so it's true that antibody levels start to go down, and we understand the recommendation for a booster, and I'll explain what the guidance is on that. But again, most people, even 6 months or more after vaccination, even if they're a little more likely to get infected, they virtually never die from this disease, and they only rarely end up in the hospital. So I say that just to say our emphasis, as much as we want to get booster doses out there, our emphasis is still trying to reach those people who've just never gotten the first shot. I mean, those are the people we really want to reach, because that's how we keep people out of the hospital, and that's how we keep people from dying. So let me answer this question. I'll come right back to you. Right now, the guidance is booster doses are recommended for any of the 3 vaccines if you're over 65, if you have any chronic health problems, which are the kind of things, unfortunately, we have a lot of in Alabama. So people with diabetes, people with heart disease, people with renal disease, there's a long list of them. Or if you're somebody who's at high risk because of where you live, like a nursing home, or where you work, like a hospital or healthcare facility, those are the people that boosters are recommended for. A booster is recommended 2 months or later if you got J&J as your first shot, or 6 months or later if you got Pfizer or Moderna as your initial series. And you can choose the product you want if you care. It probably doesn't matter that much. They all seem to be fairly equivalent, but just because you got Pfizer the first time, you could get a booster with Moderna if that's the one near your house that you can find. Or if you got J&J the first time, you can get a booster with Moderna or Pfizer. So, yes, sir.
Before the vaccines were made available, how effective was washing hands, social distancing, and wearing masks?
So I think those are also strategies that work. They're not as effective as the vaccine, but they all help. It's sort of an extra layer of protection that you can do, that you can add. And I think particularly when you're talking about, say, kids who aren't eligible to get vaccinated yet, for example, those are the kind of strategies that we have, because all you can do is all you can do. And so we don't want vaccines that take the place of hand washing. We don't want it to take the place of wearing masks. We don't want it to take the place of any of those things. But all those are important strategies that people ought to do. So, yes, ma'am.
Thank you again for being here. We really appreciate your comments and your responses to questions. My question is related to the outbreak that's happening in Russia, currently happening, the new outbreak they're experiencing. Any news relevant to our vaccines that relate to what they are experiencing today?
Yeah, it's a little unclear how that's breaking down by which vaccine. As you know, they had a homegrown vaccine product that's probably not as reliable as some of the other ones. And so that's a question that we don't have answered. How many people actually got that one? How many of the issues they're seeing are related to people who got this less effective vaccine? We are certainly paying attention to what's going on in the UK right now, as you know, the so-called Delta Plus. The issue with Delta Plus is not that it's probably more deadly or more dangerous, but again, it's even more infectious than Delta. It's a little bit easier to catch even than Delta was. A year and a half ago when this started, if we had a case of COVID, we could predict that person would transmit that disease to about 1 to 2 other people. That's the normal cycle that we were seeing. That's pretty similar to what you see with flu. Well, it's a little more than you see with flu. With Delta that we had this summer, we typically saw one case transmit that to between 5 and 6 other people. And Delta Plus is going to be even higher. We don't know what that number is going to be, but it's going to be even higher. So again, even when you've got 2.5 million people who are vaccinated, if your vaccine's even 90% effective, you've got hundreds of thousands of cases you're going to see, even in people who are vaccinated. So, yes, sir.
You talk about children. What do you see as the future in terms of vaccinations for children and ages and that sort of thing?
Yeah, so I'd say if there's been any bright spot whatsoever, it's that fortunately our children mostly don't get as sick from this disease. That we've been really fortunate that kids typically don't have the same problems as adults do. However, they still do get infected. They, can have their drive outbreaks that we see in schools that end up sending kids home, and we don't want kids out of the classroom if we can help it. We do know that there are long-term complications from this disease that are showing up in kids as well, the so-called long COVID or the so-called MIS-C or multi-system inflammatory syndrome. So there are some health complications for kids. Because of all those things, we do think kids are going to need to be vaccinated too in pretty good numbers if we're ever going to get through this. This week, the FDA is going to finish reviewing the data from Pfizer on vaccines, and very soon it's going to be Moderna as well. Next week, the CDC will take that recommendation from the FDA, assuming it's approved, and then we'll make a recommendation to us in public health about what we can do. So we think that by the end of next week that there'll be a vaccine available for 5 through 11. It'll be Pfizer. Pfizer is already approved now for 12 and up. Remember, Moderna and J&J are still 16 and up. So they're a little bit further behind, but they're submitting their data as well. I saw a story this morning about the Moderna data that just got submitted to FDA. So by the end of the year, I think we'll have, vaccines fully available, any one of those vaccines for anybody. But it's going to go to age 5. The difficult problem there is that the people in Alabama who are least likely to be vaccinated are those people who have kids 5 through 11, young parents, or young people in their 20s and 30s. They're the group that we've had the hardest time reaching. They're not interested in being vaccinated in a lot of cases. So, I think it seems unlikely that they're going to rush out to get their kids vaccinated when they're not even vaccinated themselves. So. Yes, sir.
We use the CDC guidelines for third dose versus booster.
Yeah, right.
It was also supported by the VA, a policy statement around Labor Day. So we started doing third dose Moderna mid-September, which is about the time frame of the first wave of our vaccinated patients were hitting the 6-month mark. Now that they've approved Moderna for a booster as opposed to third dose, and I believe the booster is half volume of the third dose. But if you look at the indications, they're exactly the same. And that's led to some clinical confusion. Oh, do I give them a third dose or do I give them a booster when the indications for both are basically immunocompromised patients?
Yeah.
Is it okay to use clinical intuition and informed consent from your patient?
Yeah, we're not in the business of telling you how to make a clinical judgment there. I mean that's always up to you. It is confusing, and you have to really dig into the label for who's qualified for a third dose. For those of you that don't live in that every day, remember even before booster doses were approved, there was already a guidance from CDC and FDA to give an additional dose to certain people who don't normally respond well to vaccines. Okay, so these were people, for example, maybe they were on chemotherapy for cancer, they had untreated HIV disease, they were transplant patients, they were on drugs that suppress their immune system. So those folks, it's a little less than 2% of the population nationwide. Those folks don't respond to any vaccines very well. I mean, a tetanus shot or a flu shot or anything else. And so the guidance was to give those people a third shot. And in fact, it's depending on what you read, it's 1 to 2 months after they finish their shot. So they get it right away. And that's not a booster dose. So that's just an additional dose for people that don't respond well to vaccines. The booster doses, of course, are for those groups that we mentioned just a minute ago, and the dose for that is a half dose for Moderna. It is a full dose for Pfizer, but it's a half dose for Moderna. So that's what's confusing. But there's only about 6 groups that are listed for additional doses, and they're those people that are highly immune compromised. They're not people who are just at risk for medical problems like heart disease and diabetes, but they're people whose immune systems don't work, like transplants and high-dose steroids and those kind of things. Yes, sir.
One of the political arguments recently are that those that are, that have natural immunity would have just as much protection against the COVID virus as somebody that did not have COVID but has been vaccinated. Is there an argument that for those that already do have natural immunity, could they boost their chances of not getting or a severe case by initially getting the vaccine?
Yeah, they absolutely can. That study is well recognized. It was done in the state of Kentucky. It's published by CDC and the MMWR. And if the people that have the best immune responses of all are people who have been infected who later get vaccinated, those people do the best. And they're 2 to 3 times less likely to get infected than people just with natural immunity alone. So there's no question that natural immunity is helpful. If you've had COVID and gotten over it, your risk of getting it again is definitely lower. Now we've had several thousand people who are reinfected. You know, we've had people infected more than twice. We've had people infected 3 or 4 times over the last year and a half. So some people do tend to get infected again. They tend not to get as sick the next time. So I think there's an argument that it's similar, similar protection. But the most protection you can get is to get vaccinated on top of that. You know, the main argument that we hear from that is that there's some people who just decided they don't want to get vaccinated, or they don't like it, or they're opposed to it. And so the natural immunity argument is their way of not having to get vaccinated. I understand that, but the problem is 1 out of every 50 cases of COVID are going to die. I mean, 1 out of 50, so we got a 2% mortality. And, we're still getting hundreds of cases a day. And so we're getting, dozens of deaths per day. With the vaccine, nobody dies, virtually never. There have been some from people who have had severe allergic reactions that, probably should have been predicted. We're aware of that, but every study that you can look at, any way you punch the numbers, shows that you're better off getting vaccinated than not getting vaccinated. If we could give everybody in the country natural immunity by letting them get infected and no one died from that, that would be another way to get over this, but we can't do that. There are too many vulnerable people, and a 2% mortality is about 20 times what you see with the flu. And so there's just not a way to get people naturally infected without a lot of people dying. Yes, sir.
Are you getting from the younger generation, the childbearing generation, concern regarding that if you take the vaccine, it's going to sterilize them?
Yeah, we've heard that a lot, and I think there's still a lot of misinformation out there, but there aren't too many reputable sources still passing that story around. That's been refuted in more ways than I can begin to describe to you. That is truly a Facebook rumor that went wild. And that's literally what happened there, and I'll be glad to tell you the whole story if we have time, but it came from a letter from a researcher that was peripherally involved in one of the vaccines that had nothing to do with the actual use of the vaccine, and it just got spun on social media into this, rumor, this misinformation out there. And there's absolutely no question, every bit of data shows us that a pregnant woman who gets COVID is much more likely to die than a pregnant woman normally should. Okay, so, and pregnant women who get COVID who get vaccinated are not. I mean, they virtually never die. They've almost never died in the whole history of everything that we know about. So, pregnant women absolutely should get vaccinated. Women of childbearing age, now we've had the vaccine in trials now for more than a year. It does not cause fertility problems. It does not cause problems with pregnancy. There are many people involved many women in the study trials who got pregnant during the trials, inadvertently, or, they didn't intentionally recruit pregnant women, but women who got pregnant in the trials, and there's no concern about fertility. Yes, sir.
Passing of our authorization of the FDA for ages 5 to 12. Let's talk about the parental age being 20 to 38 group, maybe that aren't fully bought into the vaccine, so they're not going to go take their kid. I've got 2 children. It was always a chore to go get a shot. I mean, it was just, you couldn't buy them enough candy or whatever. Is there any discussion regarding like the flu vaccine, whether it's a mist, whether it's a nasal dosage compared to a shot?
Yeah, we would love to see that. We don't have that right now. I think it makes sense that we could get it someday, but it's not going to happen anytime soon, unfortunately. There are still about 40 to 50 COVID vaccines that are still in production, believe it or not. They're still being studied, but none of them, unfortunately, are missed or oral. They're all injections right now. Maybe someday. Yes, ma'am.
Dr. Harris, do you think that in the near future that we might have to start receiving boosters like twice a year or something to keep our immunities up?
Yeah, I mean, I hope not. I think we just don't know yet. I think it's not clear. You know, we're all going to have to learn to live with this. You know, this is never going to go away. We're always going to have it. I think if we can get our most vulnerable people protected, you know, our seniors, our people with chronic health problems, people in nursing homes, if we can get them protected, we'll go a long way towards getting rid of the worst parts of this disease. But, you know, we may still always continue to have cases. So, unfortunately, we just don't know what the data is going to show us. You know, we you know, for example, have to change the flu vaccine. As you know, every year, the shot you get this year is not the same one that you get next year. I think it's certainly possible that a COVID vaccine may turn out to be something like that. Again, these very first products, we're recommending boosters after 6 months, but, you know, future versions of COVID vaccine, maybe they could be given annually, or maybe they could be given, you know, every 5 years or every 10 years, you know, the way a tetanus shot is. So I think as the technology develops and we get new things, that guidance is going to change, but right now we just don't know. Oh, yes, sir.
With all the prevalence of the vaccinations, the vaccines are available everywhere, one thing we've run into is testing from our end. Are the home tests, rapid tests accurate enough to, you know, warrant quarantine or hospital or, you know, the next step? Are they worth the money?
Yeah, that's a really good question. You know, are they worth the money? Depends on what you're paying, because there's a shortage, and you know, they keep going up. But they are FDA authorized, or in some cases FDA approved. So they've shown that they're sensitive enough and specific enough to work. It's a sort of a long, complicated epidemiology explanation, but the tests are better if you're testing people who are really at risk for being infected. And so if you work in a hospital and you get a real severe respiratory illness and you go take a test, that the sensitivity and specificity for the test you're taking that day is really, really high. You know, and if you're a person who lives alone at home, who's not around anybody, and you don't have any symptoms at all, but you just decide to test yourself, you know, you're at low risk, and so the sensitivity and specificity is not as good. And so if you get a test that's positive, it's more likely to be false positive, you know, in that group of people. So it does matter who's being tested also, but generally speaking, those tests are good. Just like any kind of medical decision that you would be making, a serious medical decision, you know, whether you're doing a pregnancy test or whether if you were doing a strep test at home, ideally, you know, talk to your healthcare provider and get their input on that, you know, especially if you're not sure how to interpret their results.
So stay away from YouTube, medical advice.
that would be my advice. Yes, sir. Yeah. Yes, ma'am.
I've heard about over-the-counter tests. Are those available now on a regular basis, and what are your thoughts on those?
Yeah, over-the-counter tests are available. You can get them at you know, places like chain drugstores. You can order them off the internet. They're FDA authorized, or in some cases FDA approved. So they are reliable, but again, it does depend on who's being tested. You know, if you're a sick person who thinks you really have COVID, the test works better than if you're an asymptomatic person. But they are available. The biggest problem we have actually with home tests, I mean, it's not the patient's problem, it's our problem in public health, is that we don't get that information reported to us. You know, right now, if you go get a test at a hospital or a clinic, if it, you know, whether it's positive or negative, it's reported to public health. So we know what our % positive rate is, we know how many cases we're getting, you know, and if case numbers are going up or down. So we're fine with people testing at home, you know, whatever it takes to get a test, but there's no way to really get that information to us. And so if everybody tests at home, we'd be completely blind. I mean, we'd have no information. So. Yes, ma'am.
Dr. Harris, what is your recommendation for the school-aged children that come to school that have symptoms? The school nurse assesses child is sent home with recommendations to follow with their physician. Child might stay out of school several days, and they return back into the school system, have not been assessed by a primary care physician or anyone, have not been tested. You find out through just like unknown sources, where you have to do follow-up phone calls to find out that someone within the family has tested positive, or that the child has tested positive. That impedes our data that we have to send and report to you all, as well as keeping our numbers within the school system accurate. Any help with that?
I wish I knew how to answer that for you. I know that your hands are really full with those kind of situations. I mean, you know, ultimately, you know, it's kind of part of the patient-doctor relationship. We expect the patient to tell us the truth. I mean, and if they don't, you can't make a good decision. And so, you know, my heart goes out for these families. I understand they've got a kid maybe who's not all that sick, and they don't want to take off work, or they can't take off work, and they want the kid in school, and I totally get all that. I totally understand that. But at the same time, a child who may be infectious is, you know, maybe putting at risk classmates, but also teachers and administrators and staff who are older perhaps, or have chronic health problems. You know, there are other people in schools besides kids, you know, and so it's a really difficult situation. We don't have a good solution, but ideally, you know, just like any other sick kid, you would have, you know, your guidance that you had before COVID. If you thought they had strep throat, or you thought they had mono, or you thought they had something else, you know, you try to get them to stay home until they're better. But we don't know how to make people tell us the truth if they're just determined not to do it. So I'm sorry that didn't help you a bit, did it?
I have one more thing maybe you can help me with. What is your intake on school sports, like activities when they have to ride the bus to go to the games, and they're not able to sit the 3 feet distance, and you come back and you find out one child that has tested positive, so then you have to,
Yeah. You know, that's what the guidance is. As you know, school buses aren't regulated by us; they're regulated by the feds, and so there's a mask mandate for school buses that we have nothing to do with. I promise, so don't throw anything at me, because we don't have anything to do with that. But you know, the people who need to be sent home for quarantine are going to be people who are exposed, you know, within 3 feet for not wearing a mask, and the exceptions are if they're vaccinated, if they've had COVID in the last 90 days. So that's the best guidance we have.
thank you.
Yes, ma'am.
All right.
All right, stay up here, Dr. Harris. We do have something for you. Come back up here, Dr. Harris. We have something for you. We definitely like to present. And I'm sure he's going to stick around, so if you have a question that you would still like to ask, definitely come in and see him afterwards. But on behalf of the Rotary Club of Selma, we just have a little something for you. I was told at Princeton, the way to always look busy is to carry around one of these. You know, you look a lot busier than what you actually are. So we wanted to give you one with the actual Rotary emblem on it, and it's, you know, be the inspiration.
Thank you very much. Really